Why are H. pylori ulcers becoming resistant to antibiotics? Imagine a tiny bacterium living in your stomach that can cause painful ulcers and even increase the risk of stomach cancer. That's H. pylori, a common infection affecting millions worldwide. Over time, treating these infections has become more complicated because the bacteria are fighting back. They are developing resistance to the antibiotics doctors use to eliminate them. This resistance is a growing concern in medicine because it makes standard treatments less effective and can lead to longer, more complicated health issues. H. pylori is a hardy bacterium that can survive in the harsh environment of the stomach. It does this by changing its genetic makeup, which helps it evade the effects of antibiotics. One way it does this is through mutations in specific genes. For example, mutations in the 23S ribosomal RNA gene can make the bacteria resistant to clarithromycin, a common antibiotic used to treat H. pylori infections. Other mutations can make the bacteria resistant to different antibiotics like levofloxacin. These genetic changes alter the bacteria's targets, so the antibiotics can no longer do their job effectively. H. pylori can also develop resistance by producing more efflux pumps. These are tiny protein structures that act like molecular brooms, actively removing antibiotics from the bacteria before they can do any damage. Additionally, the bacteria can form protective layers called biofilms, which act like shields, preventing antibiotics from reaching and killing them. Sometimes, H. pylori can change its shape into a coccoid form, which is less vulnerable to antibiotics. Although less common, the bacteria can also exchange genetic material with other bacteria, acquiring resistance genes through horizontal gene transfer, making the problem even more complex. The main reason for this rise in resistance is the overuse and misuse of antibiotics. When antibiotics are used improperly, such as taking them without a prescription or not completing the full course, it creates an environment where resistant bacteria thrive. These resistant strains then spread more easily, especially in areas with poor sanitation and limited access to health care. Socioeconomic factors also play a role, as regions with lower income levels often see higher rates of infection and resistance due to crowded living conditions and limited medical resources. To combat this issue, healthcare providers are moving toward personalized treatment plans. This involves testing the specific strain of H. pylori to see which antibiotics it is resistant to, often using advanced techniques like whole genome sequencing. Such tailored approaches help ensure that patients receive the most effective antibiotics from the start. Researchers are also developing new diagnostic tools that can quickly identify resistant strains, making treatment more precise and efficient. Public health efforts are equally important. Campaigns to educate the public about the dangers of antibiotic misuse and the importance of completing prescribed treatments can help slow down resistance. Improving sanitation and hygiene practices also reduces the spread of resistant bacteria. Addressing antibiotic resistance in H. pylori requires a combined effort of better diagnostics, personalized medicine, and community health initiatives. By understanding how these bacteria adapt and resist treatment, we can develop smarter strategies to keep ulcers and their complications under control. Always remember, if you suspect an H. pylori infection, consult a healthcare professional for proper testing and tailored treatment options.